and welcome.
Hi, thank you. Thanks for having me.
So you have been covering so much of the landscape of COVID-19 since the onset of the virus here, especially in the New York City tri-state area. Where are we at this very moment? Because I feel like there's hope on the horizon, and yet there's also a lot of fear because the numbers were scary last month.
Right. Yeah. I mean, it's confusing, I think, for everybody because, we're hearing on the news, numbers are going up. January was actually our worst month of the pandemic. We're hearing about all these new variants coming out. But on the other side of that, there actually is a glimmer of hope. We now have 2 vaccines that have been approved for emergency use. We've now to date vaccinated more people than actual COVID-19 cases in the US, which is a huge milestone. And I, foresee that probably in the next 4 to 6 weeks, we'll probably have another vaccine candidate out as well. And so hopefully we can get even more people vaccinated. So it's kind of, we're at like a crossroads. It's kind of bittersweet because I think we are at the moment where we actually could get past this, as we get more people vaccinated. The good news is we kind of are seeing the cases starting to slowly trend downwards. And I hope that trend continues. But that being said, because of the new variants, because everybody's kind of just over it and having pandemic fatigue, we still have to be careful, especially given how bad it was in January after all the holidays.
And you mentioned something about the variants. When you say variants of the mutation of the actual coronavirus, right?
Right. Yeah. So, the coronavirus or, SARS-CoV-2, this new coronavirus, they're known to mutate. So that part isn't that worrisome. They actually mutate every 2 weeks. The problem is when it mutates so much that there is a new variant or there's multiple mutations that might make the virus more contagious, or more deadly, which we're starting to see now. So that's why there's some concern, and that's why there's this urgency that we need to get more people vaccinated quicker. And we still have to maintain those mitigation measures like hand washing, masking, because all of these things can help stop those mutations from occurring and the variants from occurring.
Even though, like you said, people have pandemic fatigue, people are tired of it. Can we just go over some of those basic hygiene rules that can help protect you from the virus?
Yeah, absolutely. So again, please wear a mask. I don't know why, but masking has become so politicized and it shouldn't be. It's just basically like, protection, like wearing clothes or wearing a jacket. The masking itself can reduce the spread significantly if everybody is masking. So that is like a very simple thing that you can do, especially when you're around other people that you don't live with. And then, of course, hand washing, because that goes for any infection. We touch our faces multiple to thousands of times per day and can easily transplant bacteria, viruses, all sorts of germs. And then the distancing is key because this is an airborne virus, because it spreads by respiratory droplets. Maintaining that 6 to 10 feet from people, especially right now when it's cold and wintertime. Indoor is when these respiratory viruses spread a lot quicker, not just the coronavirus, but flu as well. So we have to be even more careful in the winter because we're spending more time inside in closed spaces.
And when you say 6 to 10, right? So it was originally 6 feet. Now it's up to 10. So what's the safest measure? Would that be the 10 feet?
Yeah, I mean, I would say, more distance, the better, as whatever is practical. But yeah, we do have
to break up over. Like, I just have to socially distance. It's not you, it's the coronavirus.
Right, exactly. Actually, in some ways, it's helped, we get out of social obligations I didn't want to go to. So I don't think it's all bad.
Right for me.
So I don't think it's necessarily all bad personally, but yeah, the more distance, the better, because if the closer you are to people you don't know, there's always a chance you could be spreading something to them and they could be spreading to you. And, because these droplets can travel through the air, we have evidence that it can go further than 6 feet. So that's why we say 6 to 10. But yeah, it's a good excuse to use if you want to get out of seeing somebody.
It's been a very difficult time. So if we could find some humor in it at all, that's fine.
Yeah.
I know these are all very easy to Google, but just to make it readily available information, what are some of the onset of symptoms?
Right. So the most common things by far are fever, coughing, nasal congestion, because it is a respiratory or, airborne virus. Also, a lot of times people have loss of taste or smell. But then you can have other symptoms too, like body aches, chills. Some people can have upset stomach, so they can have diarrhea, nausea, vomiting. But the scary thing about this virus is that it can present in so many different ways. So those are kind of the most common of when it's starting to come on. But then, as we've all heard, there's so many complications that can come from that are actually quite scary, such as stroke, all this, multiple organ failure. So it's really important. Another reason why I'm such a big advocate for this vaccine is we don't know who is going to have no symptoms, and we don't know who's going to be in the hospital, at death's door. And they say even those that recover from COVID-19, over 75% still have symptoms almost 8 to 9 months later, even people who recovered at home with milder forms. So again, I personally wouldn't want to go through any of that if I could avoid it.
You definitely can avoid it. And I've had several friends now that are also in their 30s. Some of them have comorbidities such as diabetes or asthma, and they have fortunately not been so affected by it. It's been, like a minor flu for them. Other people have symptoms of a head cold and they've tested positive. And then I have friends on the other spectrum who have been in ICU, and even though they were fortunate enough to get out of the hospital, they have scarring on their lungs, they're still on oxygen. And then very sadly, I have friends that lost their parents. Right. So it's definitely not a virus to play around with. And then we have this other population. And when we talk about endometriosis, that's considered a chronic illness, makes you more vulnerable. I recently had a doctor's appointment and the doctor said, well, you need to be on that vulnerable list. And I said, I just turned 38 the other day. And I said, well, I'm otherwise healthy. And she said, yes, but you have a chronic illness and you have to really be careful out there, because if you get sick, you could get really sick. As somebody who's an immunologist and an infectious disease expert, what do you think of that statement the doctor made about those with endometriosis?
Yeah, I don't think it's unreasonable, because one, we don't want to have people be afraid or cause fear or panic. But at the same time, there's so much about this virus that's still unknown. This whole time, all of us, even those treating it, have been learning about it as we go along. And we know a lot of the virus isn't even so much the infection, but all of the inflammation that comes with it, because basically it can make your immune system go into a complete overdrive that can be dangerous, and cause organ damage, blood clotting, what have you. And so, endometriosis is an immune mediated condition. There is inflammation associated with it. So it would make sense that it could be a high risk condition as well, because you're already in an inflammatory state, right? And then you wouldn't want to add more fuel to the fire by, contracting a virus that causes more inflammation and more immune issues.
Mm-hmm. And you mentioned earlier on in the conversation about a third candidate for a vaccine. So we have the Moderna vaccine, which I've heard, obviously if you can get your hands on a vaccine, that's amazing if you choose to take it. But I've heard the Moderna can have some unwanted side effects such as chills, fever, nausea, where I'm hearing less about the Pfizer having the same side effects. But what would be the third candidate that you referenced?
Right. So, right at the end of February, on February 26th, Johnson & Johnson plans to have their data reviewed by the FDA, and they could very well be the third candidate. And it's kind of exciting because this one is one shot versus two, that both Moderna and Pfizer, you need 2 shots. And so it takes longer to get to that, efficacy, immunity part of it. The other thing is it's a little bit different of a technology. So, both Pfizer and Moderna are mRNA vaccines or messenger RNA vaccines. And what they do is it's very interesting. They kind of send a recipe to your immune system on how to produce the spike protein of the coronavirus and help it mount that immunity without actually getting sick, without actually involving any actual dead or alive virus. And this vaccine is a little bit different. Basically, they use an inactivated common cold virus to carry in that same information, that genetic information of the coronavirus, and then your immune system will mount immunity that way. So, it's a little bit different. It's just different ways to introduce your immune system to COVID-19 without actually getting sick. The one-shot part of it, I think, is huge. Also, it's a lot easier to store this one. You can keep it in a regular refrigerator, unlike Pfizer's that has to be in those, sub-zero freezers. So hopefully it's easier to get people vaccinated quickly, there's been a lot of buzz on the news about efficacy, like, oh, this one doesn't look as effective as the first two, but you can't compare the three unless, let's say you do a study with all three. This one still saves lives. There was 0 deaths in the trials with the Johnson & Johnson vaccines. It also saves you from getting very ill. So it stopped hospitalizations, ICU stays by almost 89%, which is huge. That's what we want. We don't want to be, one of those people who ends up very sick or dying. So it's still a very effective vaccine. And because of the logistics of it, it might be even easier to get more people vaccinated. So I think it's exciting that we'll have a third option.
I was speaking to a doctor who treated COVID patients, and she was saying what she found very surprising is even though they have the vaccine available at her hospital, that some healthcare workers are saying they don't want it, that they're actually afraid of the potential side effects and the fact that there could be a potential chance at death. What's your response to that?
Yeah, I think unfortunately, again, as much as we're in a pandemic of the virus, we're also in a pandemic of misinformation, even in amongst healthcare workers. So that's what makes it very scary. So I think all of us actually should be more afraid of the actual virus itself than of the vaccine. I think all of us have just lost the big picture. We've lost over 460,000 lives to date, and, we're losing upwards of 3,000 to 4,000 people per day from the actual virus, whereas the vaccines have caused 0 deaths across the board. No matter what, conspiracy theories are out there, there's not one death that has been linked to the vaccine. And again, for all the reasons we said before, even if you recover, everyone's so focused on the death rate from COVID-19, you are by no means normal. I know patients who are completely healthy that now can't use their kidneys and they're on dialysis, or patients who had a stroke and now are paralyzed. And there's so many stories like that, like you had mentioned, the lung scarring, right? Once your lungs are scarred, they can't come back from that, So that's what I'd like to urge people. These vaccines have been tested. I was involved in the testing of multiple of the vaccine trials. I can assure you, all the safety checks have been followed, and I ran to get my vaccine because, like I said, the alternative is far scarier. The virus is far worse in my eyes than any potential side effect from a vaccine.
It's also been tricky, though, for people who want it to get it. The rollout's been difficult. I'm only speaking of my firsthand experience in the New York area. I'm very fortunate. My parents are about to get their second vaccine. They're obviously in that age group where they can. But for those of us in our 30s and our 40s and our 20s that want it, we're just going to have to wait it out, I assume, and keep social distancing, washing our hands, and fingers crossed.
Right. Yeah. I actually, disagree with a lot of I disagree with a lot of the rollout because, I think in order to get past this, we need 75 to 80% of the population vaccinated. And so I think a lot of these restrictions need to be loosened at this point, because as you said, there's so many people that want to take the vaccine that can't, and unfortunately we're hearing cases of, doses of vaccine being thrown away at the end of the day, which is crazy to me, because if you have someone willing to take it and that person could help us get to that, percentage that we need, why discard those doses? So yeah, I agree. There's much left to be desired.
Yeah. And I think in terms of the rollout, especially with Moderna and Pfizer, like you said, it's the temperatures have to be right. Did we lose you? Oh, sorry.
Oh yeah, I'm here.
That's all good. But Moderna and Pfizer, the temperatures have to be right. If there's someone who's not available to take it that day, it has to be disregarded. So I'm hoping that some of these kinks can be worked out. So at least there's an emergency call list of, hey, if you can pull up to this hospital and you want the shot, get the shot. That, like you said, we could reach that herd immunity. I hope I'm using that at least phrased correctly in terms of the vaccine sooner, right, and we can get back to life at least a little bit more normal.
Yeah, I mean, I personally think that system should already be in place, that at 5 p.m. or 6 p.m., an hour before these vaccination sites might be closing down, people should be allowed to walk in, or have that emergency wait list like you mentioned. So I completely agree.
Yeah. Where do you predict we're going to be in about 6 months? Do you think that we'll be able to administer more vaccines to the general population? And when I say that, the younger population, those that are not considered to be at most risk?
Yes, yeah, I believe so. I think hopefully in 6 months, more people will be vaccinated, will be further along. The other good news is we're expected to have results from our pediatric trials then. So hopefully we can even start vaccinating younger children too, because my hope is that at least before the next school year, we can have a good proportion of children vaccinated as well, if not at least adolescents and teenagers. So right now, both Moderna and Pfizer are studying age 12 and up. So hopefully that age group, we're expected to start vaccinating this summer, and then hopefully we can go younger and younger after that.
Wow. Well, thank you for your time today. Thank you for all the work that you've been doing to get us back to health and wellness.
Yeah. No, thank you for having me. I mean, this is a very important subject. So even if, we can convince one person, I'm happy to do it.
No, I agree. I think we have to keep up the dialogue.
Right, exactly.
It's very easy in the world of living on screen and Zoom meetings and social media to feel disconnected that outside of our home's walls is this pandemic that's still taking lives. And like you said, compromising people's lives and wellness and making it difficult to proceed as normally as we did prior to the pandemic.
Right. Yeah, absolutely. Absolutely.
Well, please come back. Please come
back.
Yeah,
definitely. Anytime.
I'm sure there's going to be more to talk about.
Yes, always. It keeps changing too, day to day. So constantly. I'm happy to.
Thank you so much, Doctor.
All right. Take care.